Tonight's keynote will be by Dr. Kelly Hill from Water Research Australia. I want to start our meeting by paying our respects to the traditional owners on the land of which we meet, wherever you may be joining us from, and we pay our respects to their elders past, present and emerging. Well, without further ado, our keynote tonight's Kelly Hill from Water Research Australia. We're going to record this as well for people we're going to put on the YouTube afterwards. So in case if people have missed it and have probably been at conferencing CTAC all week. And Kelly spoke about a year ago when ColoSSoS was just getting set up, and we all hear about the wastewater treatment plant monitoring and how it's used in enacting, I guess, lockdowns as well and monitoring the situation through the country. So great to have you here tonight, Kelly, and to tell us more about the work you guys have been doing.
Great, thanks, Brad, and thanks to everyone who's joined, especially if you've been at CTAC. I know it's a hard slog doing lots and lots of conferencing all in 1 week. So if you can see that slide, okay? Yeah,
we can see and hear you. Yep.
Great. So as Brad said, I was here just over a year ago in June last year, and I would just also like to give our acknowledgements from here on the Kaurna country, on the land of the Adelaide Plains. I'd like to acknowledge the traditional owners, custodians and carers of the lands and waters in which we all live, work and meet. And if you'd like to acknowledge yours, please feel free to put the name of the country that you're acknowledging in the chat. So for those of you who weren't here last time, I'll give a little bit of a brief background of WaterRA and some related research, and then move on to ColoSSoS specific progress. So Water Research Australia is a member-based not-for-profit organisation. We evolved from the CRC for water quality and treatment, and we have over a 20-year track record of facilitating and delivering water-related applied research that meets the needs of our members, and our members being water utilities and agencies, health regulators, laboratories, universities, and councils and consultancies. So I'll just recap on some of the early research of wastewater-based epidemiology through the CRC, and our signature water health publication, Health Stream, and then move on to research that's been conducted in the last 18 months in ColoSSoS. So in terms of early research conducted by the CRC and other relevant works, I firstly wanted to mention the early detection of outbreaks of waterborne gastroenteritis. It was a feasibility study done in 1996 by the CRC with Melbourne Water, and that was to investigate and document a variety of existing surveillance systems relating to the detection of gastro in the community, and then feasibility of linking them with water quality data. Information was also collated from Australia and overseas, and then there were information on methods of linking extending current Australian systems to improve the sensitivity and speed of detection. So a lot of this research that's in the past relates quite heavily to what the successes have been from ColoSSoS, so it's a bit more understandable how it's been so rapidly successful. Another notable piece of work in 1998 to bring to your attention, if you're not aware, is the Global Polio Eradication Initiative, led by the World Health Organization. At that time was the largest international public health initiative in history. And then in 2005, another CRC water quality treatment report giving an overview of waterborne viruses and critical aspects relating to wastewater-based epidemiology. This one's important to note because it provides critical review of the advent of molecular biology techniques, so traditional cell culture, viral nucleic acid sequences, and integrated cell culture and PCR. And so the application of those techniques, which we'll talk about later in the methods section. Australian research has historically been used to support national guidelines and policy. For example, a recent revision of the Australian guidelines for water recycling was made following a collation and update of the national body of wastewater pathogen monitoring data. And then even more recently, environmental surveillance has been used and recommended for antimicrobial resistance and for infections from enteric viruses. And there are reports and fact sheets available on the WaterRA website for those. So then moving into more recent times, I'll go over a bit of a summary of the virus, which I provided to you last June, and then progress that's been made in the research of ColoSSoS over the last 18 months. So in June, I presented some of this information to this group about what we knew of the coronavirus. In terms of viruses that are significant for the water sector, you may know that they are commonly found in sewage, and there is routine testing for viruses that often occurs. So there are two main groups of viruses that are commonly found. First, viruses that are more resistant, that have an external protein capsule, and they're sort of classified as having a moderate to high health significance by the World Health Organization, include DNA viruses such as adenovirus, as well as RNA viruses like hepatitis A and E and norovirus. And then there's a second group of viruses that have a lipid envelope, which is more flexible, and they're known to be more fragile. So these are detected in wastewater, but are not normally associated with waterborne outbreaks. And they include the flu virus and SARS-CoV-2. So SARS-CoV-2 is the virus that is responsible for the disease COVID-19. And SARS-CoV-2 is the 7th member of the family of coronaviruses. So its structure has a nuclear protein which is associated to the RNA inside, and it has a lipidic envelope that holds the protein. The protein S, the little orange spike in that diagram, is responsible for the connection to the host cells in humans. So we know that if we destroy that envelope holding the spike, then the virus loses its infectivity. So as a result of WaterRA's position in our membership, we've got a collaborative research history. We developed the ColoSSoS Project to aid the pandemic response and build on a lot of this knowledge. So I'll briefly update you on the project. In early February 2020, we were commissioned to write fact sheets for the water industry. And this was when it was currently still in China only. It was noted in that monitoring occurs for microbial fecal indicators of wastewater, like E. coli in water. And that type of verification monitoring of water quality is already routinely used across the country. It was also noted that if the virus becomes widely shared outside of China in an outbreak situation, that wastewater monitoring could provide a simple means to find out if the virus is present and potentially which subtypes. So a research program began development in February and to understand the presence of virus in our sewer sheds. And that program is ColoSSoS, which stands for the Collaboration on Sewage Surveillance of SARS-CoV-2. It's considered world leading due to its integrated approach between water utilities, labs and health departments. And that has enabled timely and seamless integration of sewage surveillance and clinical data, and then provides a great response capacity. So the program has 4 key phases: to ensure a national approach, to ensure reliable and robust information was being provided to health, to develop a structured system capable of fast scale up, and to facilitate research and development. So to facilitate those 4 phases, in phase 1, to ensure a national approach, expert working groups were developed. And these 4 working groups are the sampling, molecular analysis, data analysis and integration, and communication. So today I'll bring you along the journey of development in each of these 4 groups for the rest of the session. So first things first, then, looking at the sampling group. This expert working group worked on the methods of sample collection, transport, and laboratory storage. We know that these types of viruses are really fragile from their lipidic envelope, so needed to do a bit of research around that. The protocols were developed by this group and identified potential purposes of sampling for early warning, for understanding outbreaks and persistence of asymptomatic cases. The guidance was to sample using standard microbiological methods. So the standard microbiological methods were general consensus globally that that was the right thing to do, and we attended lots of working groups across different countries. So that then consisted of 250 ml sample bottles, the same sort of things that we use for E. coli sampling. Initially, the storage was thought globally to be best frozen, and the temperatures that the storage was at varied from -80 to -40 to -20 degrees C. However, later we found that if it was transported on ice and stored at 4 degrees C, the RNA stayed detectable for more than 4 weeks, which was a great result because storage at minus temperatures was getting pretty tight for capacity, and it also meant that there was less likelihood of these freeze-thaw cycles that were going to damage the virus. So then there was also the request to have samples taken daily to weekly, and this was ideally more frequent the better, because then you would be able to pick things up. Variability in sampling is quite common in terms of time of day that you take a sample as well, depending on other things that enter the sewer systems at different times of day. So in practice, most programs sample twice weekly or weekly due to cost capacity constraints. And then, of course, safety and PPE was also considered, and standard wastewater sampling PPE was globally is considered safe. So that's great. And then in terms of those protocols in action, initially the sampling programs in each state began with wastewater treatment plants. With all the lockdowns, limited travel, worker restrictions, these sampling times maximise existing sampling runs for the EPA for things like E. coli sampling. And the locations of those were also directed by the State Health Agency. The development of a combined sewer network map, which with localised COVID case Department of Health maps, was also created in several states, and that was used to help determine where samples might be taken. Some other goals of sampling included to sample young materials. So the most sensitive results will come from the youngest wastewater, so collecting the liquid stream with fresh sewage at the time of day most relevant to collecting as much as you can, so what we call the first flush. And then to sample material highest shed in the highest in shed virus, so sample at the time of day most relevant. And that depends on the sewerage system. It's typically mid-morning, and we noticed that this first flush got delayed when everybody started working from home. Everybody was sort of having lay-ins and commuting less. And also, as we target different locations, now if we were to be targeting office locations, then you'd be targeting at a different time of day. The first flush for those sort of samples are different. So in recent months, the goal has been to break down the catchment sizes of samples taken to use increased sampling. So it means targeting smaller wastewater treatment plants or developing in-network sampling techniques with the aim to have a maximum 100,000 people population sample. But the smaller we can get it down, obviously the more detailed we get. Preference was given to composite samples. So to reduce the risk of missing material, composite samples were collected over several hours, up to 24 hours, which was preferred to grab samples, which of course was just a single time of day. Ideally, composite samplers would be refrigerated. And grab samples, if they were used, they could be single samples or pooled samples collected at intervals. So sometimes we had a 2-hour period where we would take 4 grab samples at 30-minute intervals. During that time of day, considered to be most informative, like the first flush. So the sampling techniques were focused around the composite and grab, and then more techniques were developed. Composite samples were considered optimal. So grab samples rely on that timing of the sample in coinciding with the shedding event. As described before, composite samples can be taken over a 24-hour period. There are challenges with those around the installation of a sampler having adequate space, security, power supply, safely and reliably, being able to accommodate an auto sampler. And then there's also the sort of manual labor of collecting a grab sample over several hours. So inline samplers are another option. Inline samplers employ materials that are placed in the sewer for 24 hours and then removed, and that physical concentrate passing RNA virus through the passing flow. They're not yet routinely standardized. These are physically designed by engineers to minimize material in the sewer, blocking them up. A passive sampler on the right here is an example of an inline sampler. Extensive work has been conducted by Dave McCarthy's team at Monash University to develop passive samplers and build on previous research and techniques historically published. So I'll just talk a bit about Dave's work. These devices consist of a 3D printed shell encasing an absorptive material. Dave has been great, is very conscious of the pandemic situation, and has made the 3D printing design open source to openly download and print yourself, and has opened up sending them across the world for use in different countries as well. So the development of these devices built upon existing adaptations of the Morse swab, including a method that was by Satar and Westwood in 1974 to monitor polio viruses in wastewater. The absorptive material used in these devices at the moment for sewage surveillance is medical laboratory grade electronegative membranes. So they do test other materials such as medical gauze or cotton swabs, which were also used by the Morse swab, and have trialed with different variables of casing. Research is still ongoing in this area. By this stage, the electronegative membranes are believed to be the most suitable for the application. So they work by absorbing traces of SARS-CoV-2 virus in the wastewater as it passes through the body of this torpedo shape. The torpedo is then removed at the end of the deployment period and taken back to the laboratory where the membrane is removed and processed for analysis. As I mentioned, the samplers were developed by Dave McCarthy at Monash, and I'll send through links to papers and downloads of whatever. Maybe I'll send them to you, Brad, and you can send it out to people. Passive samplers are tending to be used at the moment over traditional sampling methods like grab and composite when there's a need to take samples from within the network in areas upstream of wastewater treatment plants. They provide a relatively inexpensive means to take a sample over a long time window, over a longer time than a grab, and it is much less expensive as an initial outlay in comparison to an auto sampler. So it is important to note that for passive samplers to provide a meaningful result, the sampling program should first be developed and refined, including a consideration of the logistics for collection, transportation and storage of the passive sampler before it's analysed in the laboratory. There has been a lot of work on this, and there's a lot of work still to be done. So these are some of the questions that remain about the use of passive samplers in terms of the sensitivity of passive samplers compared to grab and composite samplers, the detection limits of passive samplers, Can a passive sampler detect one shedder in every 50,000 people? And how can we improve those detection limits? And what is the optimal deployment duration? Can they retain a pulse of SARS-CoV-2 in wastewater that occurs in the first hour of a 3-day deployment? Or do they have the capacity to detect a shed virus in the wastewater that occurs in the last hour of a 3-day deployment? Those are still unknown. And what type of controls are required to ensure appropriate exposure to the wastewater? So those questions are being answered by several groups around the world. And it's important to have that collaboration of experiences from around the globe to advance confidence in this new technology. So WaterRA are supporting Dave McCarthy's team and a collaborative effort to answer those questions and to continue the collaborative network on passive sampling in wastewater. So Dave's contact details and info are there, but I will share them with Brad, as I mentioned. And I'll move on to the next phase of the expert working group, so the molecular analysis group. And there we go. So this group consists of laboratories from across the country, which were selected to participate in the ColoSSoS program due to factors including their solid experience with molecular viral analysis from wastewater, ability to scale up and handle hundreds of samples per week, and their reliability. So namely those with existing NASA accreditation for routine testing. They contain commercial routine laboratories alongside health department representatives, pathology laboratories, water agency representatives, and research institutions. I just wanted to note the emphasis on state-based working groups that we had to achieve this rapid turnaround of sample analysis that was required for effective response times. And where states didn't have the capacity or the capability, we commenced a knowledge transfer program between members of the working group and external laboratories to be able to provide that. So an example of that is PathWest, who we helped to set up to do the testing. So the working group quickly recommended that established methods be built on in developing SARS-CoV-2 analysis methods. Now, as I mentioned earlier, the PCR technologies aren't necessarily new, but these methods are being built on. So historically, the methods for viral RNA extraction, amplification, and detection are drawn from 75 years of testing for sewage and testing sewage for viruses. And these methods for extracting viruses and their RNA, PCR amplification, probing, and sequencing. Recently recommended primer sequences developed for clinical testing and widespread use for their purpose in SARS-CoV-2 testing. And they have also selected primers for the working group based on experience from clinical testing, but noting the potential interference with sewage. And I'll talk about some of these developments of each of the tests from the working group in the next bit. And as well as establishing quality assurance, quality and reporting protocols and procedures for testing pathogens in sewage. I think noting the requirement from within the group for standardization and continual improvement in quality assurance and control. Standardization and improvement I'll discuss later. And you'll see a lot of continual improvement in the next few slides. In terms of quality assurance and control, as with all clinical and environmental testing practices, they noted that the following applies. So sewage surveillance should only be undertaken by suitable facilities. Controls need to be used, both negative and positive. The choice of controls influences result. For example, like the whole virus or the free RNA, or whether it's enveloped or non-enveloped, virus controls will behave differently. At least 2 targets should be sought for every sample. although not necessarily from the same gene. And results should be considered presumptive until unless confirmed through additional testing. And results should be recorded in light of historical QC charts, as well as with the internal batch controls with respect to false positive, false negative, limit of detection and measurement uncertainty. So, given that I've just said the group wanted standardization, you might find it quite funny that there is not a general consensus globally as to what standard microbiological or molecular testing methods should be used for sewage testing. So I don't expect you to read this graph. I know it's quite table, I know it's quite small, but I just wanted to put it in here to show you that there is variation with respect to all aspects of the testing. And in almost every process step in this table, the two columns on the right show all the acceptable options that are being put forward by this working group. So the Good Practices Guide for Sewage Surveillance is soon to be released from WaterRA, and will document these acceptable options, considerations for each process step from the working group, and there will also be full standard operating procedure attachments with the guide. Many of the reasons for differences are logical, and a one best method isn't necessarily the objective. Reasons for differences between analytical methods are listed on this slide, but include, logistical constraints, limitations, and tailoring the methods to the nature of the sewage matrix. In terms of method development, I want to raise the group in Victoria have done a lot of work and includes our injectors group at WeHi, as well as Monash, Visual and University of Melbourne. And all of these methods, evaluation, optimization techniques that they've done, I probably won't be able to do anywhere near as much justice in this time as I should. So Aaron's kindly said I can share his details, so please do contact him for more. But I'll talk a little bit to some of it. So in the early stages of the ColoSSoS project, so probably around the last time I was speaking to you, we focused on assessing the performance of existing PCR-based methods. We faced several challenges in applying clinical-based RT-qPCR methods to routine use in wastewater. So challenges included the multiple diagnostic targets. So I've added that diagram here to show you the spike protein, as well as the nucleocapsid and the envelope. And the clinical testing data did indicate that the assay targeting the N gene, the nucleocapsid gene, which also sits close to the 3 end of the SARS-CoV-2 genome, provided the best detection sensitivity. So that was tested. We now know that's not the case for wastewater. Australia also had low rates of community transmission, so therefore we required a higher level of testing sensitivity. And then with the focus on maximising that detection sensitivity, it was clear that the specificity was then becoming an issue. So to tackle the first issue of multiple targets, the team compiled a list of published PCR primer sets targeting the N gene based on the clinical information. They were tested and verified as an endpoint PCR. They then tested each primer probe pair as an RT-qPCR with controls, and then with wastewater. The most sensitive kit emerged as the PerkinElmer kit. They also tested the 1-step and 2-step processes and various other kits, and based on the results, the PerkinElmer kit was adopted as the primary RT-qPCR method for wastewater testing in Victoria. Although the PerkinElmer assay was evaluated for specificity against human respiratory viruses in clinical samples, it hadn't been evaluated in wastewater. So we couldn't know if the wastewater might contain bat or rodent coronaviruses that could cross-react with the PerkinElmer assay. They explored amplicon sequencing to verify that the N and ORF amplicons produced by the produced by the PerkinElmer kit. In doing that amplicon testing, they used both the Illumina routine protocols for the MySec platform and Sanger sequencing for the PerkinElmer kit's amplicon. The kit's amplicons were small. They didn't incorporate well into those sequence libraries and couldn't be sequenced. So they explored a couple of things. They explored cloning the amplicons into bacterial plasmid, but the process was really time consuming, so not suitable for the high throughput of routine confirmation of this wastewater testing. They then tested an overhang extension PCR-based method coupled with the Illumina amplicon. And this approach allowed them to index barcode the amplicons from each sample for high throughput multiplexing. They confirmed that that method worked efficiently for sequencing both in and off amplicons from SARS-CoV-2 control cDNA, and then evaluated its performance against real-world samples based on results from wastewater samples containing positive detected material. They noted that with an increase in amplification cycles, they experienced an increased risk of contamination to the no template or blank controls. So they noticed that there was no indication of decreased sequencing sensitivity at 16 cycles in the overhang PCR. So based on that information, they selected a 16 cycle amplification as their default. And they employed 20 cycles where repeat sequencing was required and discounted any use of more than 20 amplification cycles. So the team at WeHi optimized the amplicon cleanup, library preparation, and data analysis phases of that method to minimize the time between sample receipt and result, which is now within 24 hours. So they also developed a more rapid approach to genetically identify amplicons produced by the PerkinElmer RT-qPCR assay. And to do that, they developed assays using the CRISPR detector method. They also tested RT-LAMP, droplet digital PCR, and nested PCR. RT-LAMP was found to work, but wasn't sensitive enough to complement the RT-qPCR. The droplet digital PCR, they tested 5 assays, including 2 from BioRad that target the CDC N1 and N2 region, and 2 using the Euro surveillance primers targeting the RDRP and E genes. The CDC N2 primer pair gives the highest sensitivity. And intriguingly, they found 1 of those 15 samples tested positive, and that detection was later linked to a COVID-infected individual that hadn't disclosed their travel to the region to contact tracers. They also tested nested PCR, but this wasn't pursued beyond the development phase. The amplicon sequencing, CRISPR, and droplet digital PCR methods developed here form part of Victoria's frontline wastewater testing program. So the JEX lab now uses these methods to test and verify all positive wastewater detects. Their methods are essential parts of routine monitoring program in Victoria, and they support the same-day genetic confirmation of all test results. This program is now run by the Department of Health and an integrated and critical part of their COVID response program. The testing data form part of weekly briefings to the Department of Health, and through them inform Victoria's Deputy Chief Health Officers and the Office of the Victorian Premier. So while laboratories across the ColoSSoS program have been using different methods, through the open collaboration of the working group, laboratories were starting to move towards some common standards. There's an urgent need for Australian state-based and New Zealand health agencies to have confidence in their results and an understanding of their uncertainty. So as a result, WaterRA successfully commissioned agencies to support the development of a standard and for it to be used for proficiency testing. So this is particularly relevant when quantitative data is reported, and even more so in this instance when live quantitative data is being used on a daily basis to track and manage potential new outbreaks. So we sought the services of the National Measurement Institute to run the ColoSSoS interlaboratory study as an independent organisation relative to the laboratories that were providing this wastewater testing service. The NMI sits within the Australian Federal Government's Department of Industry, Science, Energy and Resources, and their bioanalysis section participated along with 20 other institutes around the world to quantify SARS-CoV-2 viral RNA in October last year. So participation in interlaboratory comparisons is a key requirement for laboratories that offer commercial testing service under an accredited quality system such as the ISO 17025. During 2020, the NMI produced a SARS-CoV-2 certified reference material that is suitable for calibrating RT-qPCR methods. The certified reference material was provided to participants of this interlaboratory study to enable accurate and comparable conversion of CQ results from RT-qPCR analyses into genome equivalent copy number concentrations with the required traceability. The immediate technical objective of this interlaboratory study was to compare the performance of the surveillance methods that are currently being used across the regions to monitor SARS-CoV-2 in wastewater, both in terms of overall yields, which translates to method limit of detection, and in reproducibility. By identifying some of the potential reasons for performance differences, participants could then further optimize their protocols to improve consistency between the service providers. So all the participants were provided with the same wastewater replicates and virus spike material, which was set up the 10 study samples. In addition to this, the participants were provided with 3 sets of calibrants, which were pre-prepared at the NMI. Using a calibrant provides 3 major benefits to the study participants. Firstly, they could report in the same units to produce internationally traceable quantity values. Secondly, it provides the ability to assess RT-PCR assay efficiency by measuring the slope of the calibration curve. And thirdly, the calibrant can reduce assay-specific biases. So for more information about that calibrant, I'm happy to share with Brad a link to the full research report of the Interlab study. The trial found that there was a wide range of recoveries of SARS-CoV-2 viral RNA from the different participants, as expected. The average yield from each participant would be due to the effectiveness of the virus recovery protocol used. So one lab produced a significantly higher recovery yield than the others. And if you download the report, that was lab 7. Although this lab was one of 8 that used the electronegative membranes to capture the virus particles, they were the only lab to include both centrifugation and acidification as pre-treatments before passing the cleared wastewater through the membrane. Others used centrifugation or acidification, but not both. Some added magnesium chloride salt to increase virus absorption onto the membrane. Overall, the electronegative membrane recoveries and PEG precipitation performed very well, along with the hollow fiber concentrating pipette tips, but with lower recoveries. Performing a centrifugation pre-treatment to remove solids improved method reproducibility, yields, and RNA purity for the study materials that were analysed. Those benefits would have to be assessed for a range of wastewater types to ensure that they were consistent. So we've gone through an overview of works that were sort of conducted and taken up by the sampling and molecular analysis groups, and I'll go through the data analysis and data integration stuff now. So I put this slide in. I think it's a nice graphic of what our Minister for Health described as the 4 fundamental pillars to Australia's approach to reducing COVID-19. And border controls, testing regimes, contact tracing, and distancing and isolation. And if we look at this sort of testing regimes pillar and break it down again, these are all the things that can go into the testing regimes. And across Australia now, the wastewater surveillance are being incorporated into state COVID response planning measures. And what's even more exciting, the jurisdictions involved in the ColoSSoS program have shared their learnings and knowledge, which has facilitated the development of a national wastewater testing and reporting framework, which will be integrated into the National Surveillance Plan for COVID-19. This document brings together the learnings to provide national overview of the most common approaches to wastewater sample collection, methodologies, reporting, noting that the work just continues to progress in this field. The development of this work was led by the Environmental Health Standing Committees, EnHealth, and the Water Quality Expert Reference Panel, and informed by WaterRA's ColoSSoS Project, as well as individual jurisdictional surveillance programs. The content is based on extensive consultations with national experts in health, microbiology, lab testing, wastewater-based epidemiology, and public health communication. Within this document, the section that relates to data analysis regarding integration and interpretation of results reflects on the importance of wastewater surveillance as a tool to integrate with existing epidemiological data. And the integration of wastewater surveillance results therefore relies on a common understanding of what wastewater surveillance results mean. So that leads us to the interpretation. So a detection means that a person in the community is shedding viral particles into the sewer. It also notes that shedding can occur before and after symptoms or detections from respiratory samples. So if the shedding is before the onset of symptoms, and therefore before someone will go and get tested, it also relates, relating is if a person's asymptomatic, which a recent study found more than 1/3 of COVID-19 cases are asymptomatic. In both of these cases, wastewater surveillance has the potential to provide an early warning of spread in the community. If the shedding is after a person has recovered, and we know from research last year that patients receive negative respiratory tests can still shed virus in the feces for many weeks. So that needs to also be taken into consideration. Detections are also reported in various ways across Australia, and you may have noticed this in the news. And so we'll see things like detect or non-detect, or actual or expected detection. When the routine program, in terms of follow-up, if there is a detect or an unexpected detect, if the routine program of sampling is weekly or less frequently, an immediate follow-up sample is advised to be taken. So that can provide information on whether the shedding is a recovering traveller passing through, or whether it's more consistent and it's going to stay in the catchment. So follow-up sampling isn't generally required when sampling is more frequent than once a week, because at that time, sampling for the next one would already be underway. Whereas a detect means someone is shedding, a non-detect simply means no virus is found. So this could be for many reasons, like the virus is broken down and degraded in the sewage before the sample was taken, or the amount of virus was below the limit of detection. It could also be related to the sampling method or the laboratory methods. Although in Australia, we're really fortunate to have had the lab working group and the NMI proficiency work to provide confidence in our results. It's generally accepted that using reliable sampling laboratory methods and an uninterrupted series of non-detects in consecutive wastewater samples provides health departments reasonable confidence that prevalence of COVID-19 in the catchment is low. So what does it mean? What it does not mean is that there are no COVID cases in the community. With the detects being so clearly described as a need to follow up, investigate, and evidence someone is definitely shedding, and a non-detect doesn't provide the same confidence that no one is shedding. There are so many other factors that can affect it. So it can be a confusing message. And this leads me on to our final working group, the communications group. So this is where all of the sewage surveillance communication goes. All of the detects and non-detects are reported across several areas. Surveillance results should be reported to public health practitioners and epidemiologists, as well as other stakeholders, and to standardise reporting procedures, and that's encouraged for consistent communication. It's also communicated to the public. And this tiny little map here is an example of the publicly available Victorian Health Department map, which has on it little triggers of wastewater treatment plants and other sampling locations, and the different colours show whether it's a detect or an unexpected detect, or if it's higher than last time or lower than last time. So I'll also send that link around, and you can feel free to go and have a look at that. It's also, the information is also shared across state and territory boundaries. So specifically for detections from communities on or near interstate boundaries, or those that experience significant volumes of direct cross-border movement. It's really important to share those results. And also it's reported nationally. So this is done at the Australian Health Protection Principal Committee. And at WaterRA, we're really proud to say that we've aided in the national collaboration, which is, they've said, is the hallmark of the Australian COVID-19 response to date. And then I thought I would just sort of follow up with some examples of where this research has gone. So I mentioned the detection of sewage last November, previously in the method development phase, which was in Benalla. With that guy that was found to be positive after he hadn't disclosed his location. In October last year, the Sydney Wastewater Surveillance picked an early warning detect, and residents in southwestern Sydney, fragments of the virus had been found in the surveillance program, and they put out a call for locals to go and get tested, which was taken up really well. The next two are Victorian case studies. So you may have heard about this one. Last month, the Targeted Wastewater Surveillance Program, which targets high-rise public housing, among other areas of concern, received a detection at 480 Lygon Street in Carlton. Based on that wastewater signal alone, the entire complex became a Tier 2 exposure site, and all residents were encouraged to get tested. A case was then found with someone living in that building, and in turn, another case in 2 apartment blocks were found later. And that early warning from wastewater was coupled with the clinical response to help contain that cluster. And then finally, an example of a township scale early warning. This wastewater test found positive results in 3 samples dated the 10th to 11th, 13th and 16th of August, resulting to an increase in community testing. By the 19th of August, 12 COVID cases were found, which led obviously more awareness in the community. People kept coming forward to testing. Yesterday, when I looked it up, this was up to 112 cases in the community. So it's a clear example of where the sewage testing can really raise early warning. Although case numbers are rising, and the situation in several states right now is less than cheery, I think the results and uptake of the ColoSSoS project into real-world knowledge transfer and impact is a huge leap forward for the potential of wastewater-based epidemiology, and for it to be recognised, and also to give recognition to our extremely talented researchers and the hugely collaborative water sector. And Water Research Australia just want to give everybody the recognition they deserve. So it doesn't stop there. This is my last slide. There is ongoing research from across the ColoSSoS collaborations, developments on the passive sampling, as I mentioned. The methods in variant detection are also being developed, which will help us when it comes to opening borders, particularly international borders. At the moment, variant detection work is quite boring because we know if it's the Delta, it'll all be the Delta. When we open the international borders, it'll become a lot more significant to have that information of which variant is. And we're also working with the NMI and the Commonwealth Department of Health to continue the next round of proficiency, aiding proficiency around inhibition of wastewater, and waiting on the Australian government's national sewage strategy. So that framework that I showed you before will be built into the national sewage strategy. And then to look out for the good practice guide, which will be released soon by WaterRA. And there will be a ColoSSoS symposium on October the 21st, which will showcase the works of sewage surveillance in a low case setting for early warning. And it'll be over a course of 4 hours or so. So rather than my rapid summary that I think I've probably gone over time, but I've tried to share with you all today. So that's it from me